Hello, my name is Harshal. Welcome to another video where we practice from chapter medicine for the CPT book. If you're someone who is preparing for CPC examination or some other medical coding certification or someone who is just a medical coding professional, why not subscribe to this channel and also leave a like. All right. Starting with this question, a physician provides a single evaluation and management evaluation during an outpatient hemodialysis procedure for an ESRD who experienced acute hypotension during the session. How should these be coded? You will got 4 to 5 minutes to answer these questions. Well, if once you have got the answer, why not to move ahead 4 to 5 minutes and there you will. I'll be telling you the answer as well at the end. All right. Moving on to okay, the answer to this question is yeah, obviously question option C, that is number 5, as it is used to report a single physician evaluation during hemodialysis procedure. Moving on to next question, a nephrologist manages the outpatient ESRD care for a 34-year-old. The physician conducts three face-to-face visits over the course for a full calendar month, code appropriately within these four options. All right, answer to this question is option A. For full month outpatient ESRD services for an adult, codes are selected based on number of face-to-face visit. That is why 90960 represents four or more visits, and 961 is two to three visits. Since here were only three visits, that is why, since 960, that is why we'll go with this code. Should be option B, right? Since conducts three face-to-face visits. And three visits are mentioned on 961 code. All right, moving on to next question. I have to check that one. An infant with acute renal failure requires continuous peritoneal dialysis. The physician provides a daily inpatient management for the fourth consecutive day. What CPT code is reported here? All right. Correct answer to this question is option A. That is daily inpatient outpatient management of dialysis other than hemodialysis involving a single physician evaluation is reported in code 945. So option A. Moving on to next question. High resolution esophageal motility testing with an acid perfusion study is performed. The physician provides both the technical and professional interpretation of components. What is the correct coding combination over here? All right. Answer to this question. Question number 14 is option B. Esophageal motility studies reported via 91010. And the acid perfusion test is an independent diagnostic maneuver reported using 91030. All right, moving on to the next question. A patient presents for a 24-hour intraesophageal pH monitoring study utilizing a transnasally placed catheter with telemetry. The technical component is performed at the facility and physician interprets the data in their office. What code and modifier combination should the physician bail here? All right. Answer to this question number 15 is obviously with modifier 26. So option B, code 91034 is your answer. Moving on to next question. A specialist performs a non-invasive blood test for the detection of this certain bacteria. The physician provides the testing kit, administers the blood test in the office, and ships the sample to an outside lab for analysis. How should the office portion be built here? All right. The answer to this question, number 16, is option C. The clinical this administration for this bacteria should be reported with code 83014. Moving on to next one, question number 17. Apologies if you have seen the answer there. All right. An rectal manometry is performed to evaluate chronic constipation. The procedure incorporates a new CPT 26 diagnostic framework that bundles the high definition sensory map recording with balloon expulsion testing. Which code is assigned here? All right. So the answer to this question is option B, as an introduction of the code 91124. All right, moving on to 18th. If you like what I'm doing, please like and subscribe to the channel, and also leave a comment. Let me know what is your feedback on this video and what do you want me to do in the next one. All right, 18th, an established patient with progressive open angle glaucoma receives an intermediate ophthalmological evaluation by an optometrist, including a visual acuity test, external ocular examination, ophthalmoscopy, and a biomicroscopy evaluation. What code do you find is appropriate here to quote? All right, this one should be easy for you guys. Also coming up. So, answer to this question, question number 18 is option B. That is 012. That is represents an intermediate ophthalmological service for an established patient. Moving on to next one, number 19. A physician performs a formal quantitative compulsorized static threshold perimetry visual field exam on both the eyes for a patient on long-term hydroxychloroquine therapy. How should this be coded? All right. Answer to this question, question number 19. Please, before the answer, please like the video if you like what I'm doing. Answer to this question number 19 is option A for 92083, which represents an extended quantitative visual field examination. Moving on to the last question, please again a reminder for you guys to subscribe to this channel and leave a comment. A specialist performs scanning, computerized ophthalmic diagnostic imaging of the posterior segment, focusing on the optic nerve of the right eye for glaucoma staging. How is this exactly coded? All right. If you have not got the answer to this question, please pause the video. I'm going to tell you the answer to this question. Option A has to be the answer for this, as for diagnosing imaging of the posterior segment is reported with code 92133 with coding the right side as well for the right eye. All right. Thanks for watching this one again. See you in the next one. And also let me know in the comments what do you want me to do in the next one. I do read the comments as well. Yeah. Thanks for watching this one and please like and subscribe to this channel. And I'll see you in the next one. My name is Harshal. This is Decode Healthcare with Harshal.